Corneal abrasions are one of the most common types of anterior segment trauma. One study documented that among all emergency room visits in patients with ocular complaints, approximately 24.3% presented with corneal abrasions. A corneal abrasion occurs when the corneal epithelium is physically removed from the corneal surface. The most common etiologies of corneal abrasion involve the following causes: fingernails, sport-related trauma, makeup brushes, and airbags. Children cause many fingernail injuries to the cornea, as patients are often parents who become injured while holding a small child. Automobile airbags can cause corneal abrasions and are frequently associated with blunt force trauma as well as alkali burns. Corneal abrasions can also occur in the hospital setting. These incidents may occur during surgery, when the patient is under anesthesia, and are not recognized until the patient awakens, or they may occur in an admitted unconscious patient. Corneal abrasions result in acute pain, tearing, blurred vision, photophobia, and a foreign body sensation. These injuries may be associated with corneal lacerations or foreign bodies. The prognosis is largely dependent on the size of the defect, wound contamination, depth of the injury and involvement of Bowman's layer. Seidel test. A thorough history is always important since the mechanism of trauma can provide much useful information. If plant or other organic matter was involved, the risk of bacterial and especially fungal contamination must be considered in order to guide the choice of prophylactic medications. Injuries that are associated with blunt trauma should alert the physician to the possibility of additional intraocular and extraocular injuries. Corneal abrasions and lacerations from fingernail injuries are prone to result in recurrent erosions due to disruption of the corneal epithelium's basement membrane. Topical anesthetic eye drops, such as tetracaine or proparacaine, will reduce the patient's pain and tearing, and usually make the ocular examination more comfortable for the patient and thus allow the examiner to perform a more complete examination. Anesthetic drops should not be used beyond the exam room as they can lead to devastating complications, such as corneal melts. Abrasions may be visible to the examiner without magnification. Typically, the corneal light reflex is disrupted and the area of the abrasion may appear dull or hazy. Fluorescein dye adheres to the basement membrane and corneal stroma, where the corneal epithelium has been lost. The dye fluoresces bright green with a cobalt blue light source, which elucidates the extent of the injury. A complete ophthalmic examination should be completed to rule out other injuries, and a Seidel test should be performed if there is any suspicion of anterior chamber penetration. Treatment should be initiated to protect against infection and promote healing with antibiotic drops or ointments and ocular lubricants. Pseudomonas antibiotic coverage should be considered in contact lens wearers. Subscribe our channel for more videos.